Dr. Pragya AHUJA.
Good morning, respected judges. Good morning. Good afternoon. I'll be discussing my paper is titled Overview of Pediatric Keratoplasty in Eastern India, the implications, techniques, complications, and the surgical outcomes. Pediatric keratoplasty is a challenging procedure with high rates of rejection and eventual failure. There are issues with compliance due to use of medications and the restrictions of travel. Some indications in itself have poor prognosis in such patients. These patients need repeated procedures and repeat EUAs. And finally, a very limited data is available on this topic from India. The purpose of this study was to analyze the demographics, indications, techniques, and outcomes of pediatric keratoplasty from a tertiary center in East India. Our methodology, it was a retrospective study with the age group was less than 16 years. Timeline was January 2017 to March 23, and we all these the study outcomes were seen at 1 year. And the complications and secondary interventions that were done were during this duration of 1 year. The outcomes measured were in terms of demography, geography, the surgical indications, techniques, overall outcomes, follow-up at 1 year, the complications, and any secondary interventions that were done. So 258 keratoplasties in 245 eyes of 236 children were included in this study. The mean age was about 10 years. Significant male predominance, 1.75 to 1 was the ratio. 59% children travel more than 250 kilometers, and which became a significant factor for follow-up visits. And it also increases the cost of therapy for the child's family. The indications, the main indications, the most common was infectious keratitis, followed by keratoconus and corneal opacity. Correspondingly, the surgeries performed, most common was therapeutic PK, followed by DALC, and then optical PK being around 19 and 17% each. The follow-up at 1 year was in 68% of patients, of which 121%, that is 69%, had a clear graft, and 3.4% of these ended up thigh-sickle. The median GAs that were required for keratoplasty and follow-up, including EUAs, was about 4, ranging up to 18 in some patients. The complications, the major ones that we saw were infection, glaucoma, and rejection. Infection included the residual infection as well as a secondary infection in the graft. This should be differentiated from the end-off, which was seen in 7.9% patients. Most common complication was graft failure, which was seen in about 25% of these patients. The secondary procedures, there were about 114 secondary procedures performed in 75 eyes, that is 30% of these eyes. And the secondary procedures most commonly done was the additional VR surgery. Then tarsorrhaphy was done. Intravitreal antimicrobials were given in about 10% of these patients. 6% of these patients ultimately required a regraft. So our indication data is different from other studies of similar socioeconomic status. We have compared a study with 3 similar studies that have been done. First in Nepal, where the most common indication was keratoconus in pediatric age group, followed by infection. Their overall graft survival rate was 78% at 1 year follow-up versus 69% in our series. And there also the major factors for graft failure were rejection, infection, and glaucoma, which is similar to our study. In a Mexican study, keratoconus was again the most common indication, followed by post-hepatic scarring, traumatic opacities, and bullous keratopathy. A similar study conducted in Iran had the most common indication was keratoconus in 58% because most allergic eye disease is seen in that area, followed by congenital opacities and regrafts. They performed PK in most of these cases, 90%, followed by DALC and DSEC. In a iris registry data, the analysis in which they analyzed about 544 eyes, of which 47% had complications compared to 53% in our study, and the 30% of those eyes had infection, which was 21% in our eye. The similar post-op complication rates were seen. So we realized that the most common indication in surgery is therapeutic PK. High rate of infectious indications are seen. There is high indication of DALK and ALK in patients of keratoconus, and we had a good follow-up of about 68%. Post-op complications are infection, glaucoma, and rejection, which follow the adult trends. And future plans are to have subgroup analysis and include children up to 18 years. Thank you for your kind attention.
So very good, very nice paper, and very, very much needed from the eastern part of India.
Yes.
So your common reason, what other countries show is keratoconus and
Yes,
other ectatic, but yours was infection?
Infection, yes, ma'am. Most of the patients, it was a tertiary referral center for cornea, so most of our patients were of infections, including adults. So therapeutic PK was commonly performed. In our study, the second indication was keratoconus, which is lesser compared to other parts. And the keratoconus that we see, most of the patients we have done DALK, there was a difference of 1% between the percentage of keratoconus and the DALK and versus optical PK that we have done from them.
Yeah, yeah. But in India, most common cause always remains infections, injuries.
Yes, ma'am.
Yes, that is very much evident from yours. Thank
Yes,
you.
ma'am. Thank you.
Excuse me. Hello. Pragya.
Sorry,
Yours
ma'am.
is a pediatric keratoplasty. Huh?
Yes, ma'am.
At what age in keratoconus you did keratoplasty?
Ma'am, depending on the K values, we decide when to intervene. If the pachymetry is less and the K values are very high, then we have done DALK in about 8 to 10 years of age group also.
Age only.
Yes,
With
we have.
clear graft and all
Yes, ma'am.
results are good?
We use good corneas. We set above 3,000 we take. Even if we have to strip the DM, still we keep so that the stromal thickness is good. And we used to keep our young pediatric, even full optical PKs. Whenever a young donor used to come, we used to schedule our pediatric cases at that time.
Okay, thank you.
Thank you.